Bom, gente, today we'll talk about aortic dissection and aneurysm. So, an aortic dissection, dissect is like cutting the aorta open. And so, we'll be doing that, actually, the medics will be doing that procedure when there is a life-threatening condition. Because here we can see we have the aorta and there is a lot of pressure here. So the blood enters here and then it does a false lumen and it can explode and it's not explode, right? Burst, and there can be bad consequences. So we'll be doing that. The medics will be doing that. And also if there is actually an aneurysm. And so let's begin by the beginning. So every cell needs oxygen and we have special delivery cells. They are called red blood cells that go through and that will give the oxygen to every cell through the circulatory system. And the aorta is the biggest and the main artery in that circulatory system. And so the aorta is this one over here that goes up from the heart and goes side by side with the spine and then divides in the iliac a little bit above the iliac bone, this one here. And then this is sagittal, okay? And so we can divide it in sections like the aortic arch, the thoracic aorta, and the abdominal aorta, all right? And then it looks like a how do you call it? It's a Irish pipe. Irish pipe. Irish pipe. I don't know if you can see here. No, not that one. This one looks like an Irish pipe. Why? Aorta. You can see it divides into three. So we have the aorta, the aortic arch, and then we have the brachiocephalic, which goes to the brain, the aorta branches. So we have the so if you touch your neck on both sides, you can see the right common carotid and the right and the left carotid. The one that goes to your arms is the right subclavian. The one that goes from the aorta up to your brain is the brachiocephalic. Brachio is arm, and cephalic is from just let me, I don't want to say anything. Brachio, ethnology. Yeah, something like this. Etymology. And phrase two-headed brachy. The term biceps brachii is a phrase meaning two-headed muscle of the arm. Yeah, so brachii would be arm. So brachiocephalic We have the left subclavian, which goes to the other arm, the left common carotid. Okay, so we have the celiac trunk, the renal artery, and here it's very common that in the inferior mesenteric, so in this part over here under the kidneys, it's common to have aneurysms. You see the iliac bone here in the iliac, common iliac, right? And so we have that. Okay. Now, where were we here? Okay, the aorta. And so what causes it? Hypertension. So lots of stress, and we have degenerative changes, So the blood is very high, and like it keeps hitting the aorta, which has the initial, which has the intima, the tunica intima. We have the tunica media and the tunica adventitia. And so also connective tissue disease like Morphin syndrome or Ehlers-Danlos. Also aneurysms can cause these aortic dissection. Trauma like car accidents or anything like that. Men are 3 times more likely than women, because God did like that. And they don't know yet why it is. Why? And the peak happens between 50 and 65 years. Right, so what happens? We have the initial tear by hypertension, connective tissue, or whatever, and then the blood comes in and makes a false lumen, right? And it can burst. And then it would exit here. So what happens is that now it's doubled, weakened, it's twice weakened, and it can burst. That is very bad. And it will separate the intima tunica from the media tunica. And so that is bad, right? Because now this is way weaker. All right, and so we have the Stanford system. We have the A, which was the most common and more dangerous. When from the arch, that's type A, aortic dissection is most fatal, and it happens from in the arch, which goes from 2 centimeters, right? Above the heart, and go all the way to the origin of this left subclavian artery. And then we have from the left subclavian artery origin to down, it's the rest of the aorta. And it's very common as well to happen very near the LSA artery, the LSA, all right? And so symptoms: sudden severe central chest pain. If you have that, you might have it, right? Sweating, nausea, shortness of breath, weakness, syncope, which is fainting. And so to know what we can, right, to diagnose it, we have the TEE, transesophageal echocardiogram. It's very quick and cheap, but it's not too sensible. They will send a wave sound and go through the esophagus and see what's happening. Also have the computerized tomography, the CT scanning with iodine contrast to see what's happening. So you can see the whole, the entire aorta, because it's like golden. You put that contrast, normally it's gold, and then you can see everything black and something that is very shiny inside. Also, we have magnetic resonance angiogram, the MRA, which is 100% sensitive and it's very specific. And so next video will study how can we, now that we have the symptoms, and we know that there is something there, how do they treat it?